Republicans have reached the conclusion that this is not a perfect bill. Well, they're right. And while my problems with this bill are very different than theirs, I do hope that in the weeks and months to come after we pass this reconciliation package that we will improve it. But I would ask my Republican colleagues to tell me something. When they controlled the White House and they controlled the Senate and they controlled the House, when President Bush was our president, during that period, 7 million more Americans lost their health insurance and health care costs soared. Where were they then in talking about health care? Did they have one substantive idea during that period about how we were going to lower the cost of health care for Americans and provide health insurance for all of our people? Mr. President, I do hope that after we pass reconciliation, we are going to improve this bill. And in that regard, I want to thank Senator Reid, Majority Leader Reid, who has promised us, Senator Merkley, myself, and others, that we will have the chance to vote on a public option provision. I think millions of Americans understand that public option is a choice that people should have, the right to go outside of the private insurance companies for their health insurance, and that public option will provide competitive pressure on the insurance industry to control soaring health care costs. So I very much appreciate Senator Reid telling us that we are going to have a vote on that issue within a couple of months. Mr. President, this bill is a strong step forward. It is no small thing that we are providing health insurance to 32 million more Americans. It's no small thing that we are moving to eliminate pre-existing conditions as a grounds for rejecting someone for health care. It is no small thing that we're going to begin to fill that donut hole so that seniors will be able to get the prescription drugs they need in an affordable way. Those are, among other achievements, quite significant. But having said that, after the passage of this legislation, we still have got to deal with the reality that we will continue to spend far more per capita on health care than any other major country. Just a few days ago, we had the ambassador from Denmark visiting Vermont. In that country, they provide quality care to all of their people, and they do it spending about 50% of what we do, because they have eliminated private insurance companies and all of the administrative and profiteering costs associated with private insurance companies. And I hope that we will one day allow at least states the option to move forward with a single-payer Medicare for all program, which I think ultimately is the way we're going to go as a nation if we're going to solve the need for comprehensive, universal, and cost-effective health care for all of our people. But, Mr. President, I do want to say a word on one aspect, one provision of this bill, which I think is enormously important. And I'm very, very excited that it is included in this bill. And again, I want to thank Senator Reid for his help in making sure that it remained in and is amply funded. And that is that in this legislation, we are going to take a giant step forward in providing primary health care to the people of this country through a major expansion of community health centers and the National Health Service Corps. This legislation provides enough funding so that we are going to create over the next 5 years 8,000 new health center sites, more than doubling the number that now exists. We are going to increase access for primary health care, dental care, mental health counseling, and low-cost prescription drugs to an additional 20 million Americans in every state, in every region of this country. That is a huge step forward in providing basic health care to millions of Americans who today cannot access that care. And while we do that, we are also going to significantly expand the number of doctors, the number of nurse practitioners and dentists that we desperately need in order to provide primary health care to our people. This legislation triples, over a 5-year period, triples the amount of money going into the National Health Service Corps, a program which provides debt forgiveness and scholarships for those doctors and dentists who will be serving in underserved areas throughout this country. We are going to provide an additional 17,000 new primary health care doctors, dentists, nurse practitioners, and mental health professionals through this program. And what this means, Mr. President, is that if somebody has no health insurance, if somebody has Medicaid, if somebody has Medicare, if somebody has private health insurance, that individual is going to be able to walk into a community health center and get the high-quality care they need. And the incredible thing, Mr. President, and this is really quite remarkable, is that by doing this, we're going to actually save taxpayers money, because we're going to keep people out of the emergency room, which is the most expensive form of primary health care. We're going to prevent people from becoming sicker than they should and ending up in the hospital at great expense. Mr. President, this legislation is going to be very significant in providing the primary health care that we need as a nation, and I'm very appreciative that
Senator's time has expired.
Thank you very much.
Senator from Montana is recognized.
Much time remains on our half hour.
2 minutes and 40 seconds.
President, I yield 2 minutes and 40 seconds to the Senator from Missouri.
Senator from Missouri is recognized.
Mr. President, we have had a lot of that childhood story that we all learned of Chicken Little. We've had a lot of Chicken Little around this building over the last few months. The sky is falling, the sky is falling. And you know, I woke up this morning, I looked up, and the sky was not falling. And every day that goes by in America, people are going to realize the sky is not falling. In fact, as time goes on, that sky is going to get bluer and brighter, because people in America are going to realize that this bill is not full of booby traps. It's full of good things that will reform health care. But I rise this afternoon just to take a couple of minutes to talk about a new low of obstructionism, taking game playing to a whole new level. And I was supposed to convene a hearing on the contracts for police training in Afghanistan. Now, this is a very important part of our mission in Afghanistan, is the training of local police departments. There was a witness that's going to be there from the State Department, a witness there from the Defense Department. The Inspector Generals were going to be there. And just last week, GAO wiped out a contract that had been let on police training because of problems in the way the contract was competed. So this hearing was timely, and it's important. We cannot succeed in Afghanistan if we do not have effective police training. And these contracts are problematic. The State Department is supposed to be overseeing it. We have hundreds of millions of dollars that's not accounted for. So what do I find out this morning? The Republican Party is not going to let us have the hearing? What in the world? Why in the world are we not being allowed to work this afternoon? Why in the world are we not able to ask questions at a hearing in a few minutes as to why the police training is not going well in Afghanistan and how we can do better? Our men and women are over there, and they are at risk if we don't get this right. I don't get it. I don't get what the purpose of saying no is. I don't get what we accomplish. We're sent here to work. We're paid by the people of this country to work. And the idea that I had to call these witnesses and say, go home, because the Republicans won't let us have a hearing? Somebody's got to explain this to me. Disagree with us.
The majority's
Debate.
30 minutes has expired.
Vote no, but let us work. I implore you, let us work. Thank you, Mr.